Hi, one of the topics that I wanted to chat about is our most common consultation, which is a positive ANA. That's an anti-nuclear antibody blood test that is positive in about 10 to 15% of the general population. This does not mean you have lupus. It is a screening test that is done for autoimmune diseases many times. So what really matters is the follow-up questions that we do in rheumatology. Lupus has very strict criteria, and you have to have 4 of the 11 criteria in order to even be considered for lupus. But some of the questions that we will ask are, for example, like, do you have a butterfly rash across the face? Do you have oral or genital ulcers? Do you have dry eyes or dry mouth? Do you have small joint swelling in your knuckles or in your wrists? And then there can be systemic findings that are very concerning too. Do you have inflammatory lung diseases? Do you have inflammation around your heart muscle, which could be something called like pericarditis? Things like that can happen in lupus patients, for example. Kidneys can be involved. You can have protein in your urine, which is very concerning in lupus patients. You can have blood disorders and blood count disturbances like a low white blood cell count, low platelets, or hemoglobin and hematocrit, can be low. So those are all things that we're looking for in order to, diagnose lupus. And so not only do we look at the blood test, but then we also are looking at systemically what's going on your exam. So these are some of the things that we're looking for. And then, of course, we do a very specific follow-up panel. Double-stranded DNA is very commonly done in order to diagnose lupus. We look at complement levels, C3 and C4. Those are blood tests that we do in order to see, is there activity in your immune system? When it's low, it generally is more likely that someone has lupus activity or autoimmune activity going on. So it's a very nuanced diagnosis that is not just one blood test. Many times we're taking into consideration many different things in order to diagnose an autoimmune disease, and many times we're specifically asked about lupus. So I hope that helps. If there's any questions, please comment below.